OBGYN, and today we're gonna talk about complications of external cephalic version, ECV. Okay, what's an external cephalic version? It's a manual. Okay, it's a procedure to bring the favorable cephalic pole in the lower pole of the uterus that helps in the delivery. Okay, and this is done if there is a breech presentation or a transverse line, and this procedure is carried if it should be carried, it has a criteria. Okay, and it's done if the what you call gestation is more than 35 weeks. Remember, this should be more than 35 weeks. Okay, and on ultrasound you should confirm that the amniotic fluid volume is adequate. That's really very important. And soon after the procedure, before the procedure, NST is done. So many procedures, so many things has to be done before doing this procedure. So now we are talking about the complications of this procedure. What happens when it's done? What are the complications can take place? Remember, the most important is the fetal distress. Okay, and the fetal loss rate is about 1%. Okay, and a preterm labor can take place. As we are playing with what you call delivery, preterm labor can take place, right? And the premature rupture of membranes, then abruption could take place. Okay, very important complication, that's the amniotic fluid embolism, very important, and could lead to death, right? And uterine rupture is really very rare. Uterine rupture is really rare. Okay, and a feto-maternal hemorrhage can take place. Feto-maternal hemorrhage, guys. Okay, so let me revise once again. What are the complications of ECV? Remember, ECV, this is a maneuver to bring what you call a favorable cephalic pole in the lower pole of the uterus. It is done in a breech presentation or a transverse lie, and it's carried after 35 weeks of gestation. And before the procedure being done, you should confirm the adequate amniotic fluid by ultrasonography, and you have to take NST before and after the procedure. Okay, and what are the complications of this ECV? Is a fetal distress, preterm labor, PROM, that's a premature rupture of membranes, abruption, amniotic fluid embolism, uterine rupture, that's a rare, and feto-maternal hemorrhage. Okay guys, so thank you so much for watching this video. Take care.